Hi, welcome back to Two Mediums and a Large. There are certain professions that sit on the edge of life and death, and hospitals are one of them. Today, we're talking to a nurse who has experienced things that blur the line between medical and spiritual. So, welcome, Maddie, and thank you for joining us.
Hi, guys. Thanks for having me.
Yes.
Hi. Sorry.
So, we had talked a little bit about some of your experiences. You said you've been a nurse for how long?
6 years.
6 years. So you've witnessed a lot of things, and you probably just have a different outlook than some of us in the spiritual community because you were working more on the 3D scale medically. So how has that shaped your belief systems?
It's definitely strengthened it a lot. Like I can say like before I even like worked in the medical field, I had like this, idea and this, perception of how things worked on the other side and how, spirits behave and everything. But since like working in the medical field and seeing things firsthand after, people have imminently passed away and their spirit leaves and they sometimes they like to hang around. So that definitely kind of strengthened the whole idea for me that, there is, spirit after everyone passes away. And what comes of it is definitely very prominent and very obvious in an aspect.
Yeah. Is this common for people that you work amongst, or like is this kind of like a taboo topic?
No, definitely very common. Like it's a
Okay.
very like well-known thing. Like after someone passes away, like a very strict thing you do is you open the window so spirit can leave and they don't hang around in the room. They can move on if they want to, or they can do whatever they need to do in their spirit world before they people go on to the light or whatever. And also they are like, oh, like people know that when people are going to come and pass that there is a certain set of things that are done. Like, if they have a priest or they were like Catholic, the priest comes in and, they get blessed. So there is kind of like this idea that, you know, when the time is coming that, people have these set of things that is done specifically about like, preserving their spirit or, their higher power, their energy that, we do for them.
I have a question
So
here. Sorry.
Mhm.
Have you ever seen a spirit leave a body?
No, well, not for like someone I've worked for, but I actually have seen like in my dreams. And I've had like a kind of
Okay.
like an astral projection type thing, but that's a whole different conversation. But I have myself, but not for like another person.
Okay. Cool.
I
interesting.
just want to
So do you
say, I'm sorry. I just want to say, first of all, I think it's great that you're a hospice palliative care nurse.
Thank you.
When my mom was dying, she was on hospice, and I
Mhm.
have great respect for those nurses because it does take a certain kind of nurse to
It's
be
a
able to
lot
do that.
mentally, yeah,
Um,
for sure.
yeah,
But I
it,
love what
it
I
really
do, and
does.
I'm
It's
glad I
it's a
can.
mental thing, but you also have to have a certain kind of energy to do it as well, right? There's a lot of death you
Exactly.
come across every day. So I don't know if I can ask this question yet or not. Lara, do you mind if I ask a question, or is
no
that okay?
problem.
Um,
Yeah.
So you were talking about people that, like the priest comes in and gives last rites and all of that.
Hmm.
I'm wondering, do you or what it's like when people are passing and they don't really have any beliefs? They're not spiritual, they're not really
Hmm.
religious. Do you feel a different energy in the room, or is it
Hmm.
to me, I would think it would be the same,
Particularly,
but
I mean, there is like obviously you can feel them there as well, but nothing like very obvious or like that stands out to a T. But I don't know, it's different for everyone because like some people like have obviously history and wasn't the nicest person or whatever. You can kind of feel the tension a little bit, but nothing like very obvious.
okay. Go ahead, Lara. I'm sorry, I didn't mean to interrupt you.
No, 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 that's okay. I just wanted you to walk us through some
Mhm.
of those very interesting stories that I think that our viewers would love to hear.
Sure.
Yeah, so go ahead.
Okay, I'm just gonna read them right from my phone because I have a it's easier just to read right from my phone because I have them in our messages. So we'll just call this patient Sandy because that's who I refer to her in our messages. Everything's changed, obviously, for HIPAA violations and all that stuff. So none of
Yeah.
this is actual real names. So Sandy, for months on end, during like my night shift when I worked, or during other night shifts, like would ring in the middle of the night, and she'd be like, I just have this feeling like something bad is going to happen. And, you know, all the nurses were kind of like, oh, you know, Sandy, like you're just, you know, having anxiety, you're getting, you know, you're having a nightmare, you're going to be fine. Just go back to bed, and just kind of chalked it up. But it's like, it happened so many times that to me, I was like, hey, maybe like something else is going on here. Maybe like she's having a premonition, or, you know, because some people do see spirits come to them before they die, especially in like hospice or long-term care. Um, so anyways, when I was working this specific night shift, it was probably around 7:30, 8 o'clock at night. We had just finished giving snack and whatever. And when a bathroom bell goes off in like a patient's room, usually it's like they've had a fall, or like it's, you know, cause for concern. So by the time I get there, Sandy had was on the floor and she had fallen. Sorry, these are kind of a little bit sad at the beginning. I'm just gonna give a forewarning. And obviously when I seen her, I was like, oh my gosh, she's imminently going to die in front of me. There's nothing I can do. And in long-term care, hospice, all these things, like, you know, people have do not resuscitate orders. So you just kind of honor that, you know, you keep them comfortable, whatever. Um, so what did I say? So she was saying to me, like, she looked at me and she said, I'm going to die. And I said, I know, sweetie, you're going to die. I'm here to help you. We're going to make you comfortable. And before I was able to do anything for her, she pulled me in and gave me a hug and had passed right in my arms. So anyways, we did what we did after we, you know, cleaned up her body, got her changed. The funeral home came and picked her up. And this was probably about the wee hours of morning, like 1, 2, 3 a.m. And we're sitting there after we had done all our things we had to do. And the call bell starts going off in her room. And I was like, me and the other care aides were working, and I was like, did we just see that? We're seeing this right. So we like went in there, obviously, opened the door very quietly. Her room was ice cold. And I was like, oh, Sandy, like, I know you're still in here. Like, we're going to open your window so you can move on to heaven. Anyways, obviously, I explained that's a thing earlier, like to open the window as someone passed. And then we're like, just, you know, like, you're here to move on. Your family's said goodbye already. Anyways, we ended up closing the door. Nothing happened that the rest of the night, but there was like nights or like evenings later on, like during that last couple weeks after she had passed, that her room still went off. She still kind of hung around and did her thing. And then when she was done, she went out the window. She just wanted to torment us a little bit more, I think, and make sure that we knew she was still hanging around. So that was that one.
That's such an interesting story.
I know, that's okay. It's just some of the stuff is crazy.
Love to do that with
Also,
technology though too, I find. That's one of
they love
the
to play with the technology or the lights or like call bells or phones, anything like that.
I also want to
Um,
say, before
mhm.
you move on to the story, I
Yep.
think that it's really great that you guys go in and speak to the deceased person that passed, right?
Mhm.
And because they are still people.
They are,
They
yeah.
were humans. Their spirits are still there, and I think that that's really a lot of people underestimate, like, that's really just what needs to be done. If you were feeling uncomfortable from a spirit, you just need to speak to them. A lot of the time, they don't realize what their energy is doing to us in the
Mhm.
physical,
That's very true. I agree.
especially if they're newly passed. And, you know, she probably just needed a little bit of that guidance, hearing your voice, that
Mhm.
comfortability to, you know, make the full transition. Of course, spirit is greeted by their loved ones when they pass, but sometimes, you know, especially in a setting, could take a little bit longer just to adjust to the different frequencies and stuff, right?
For sure. All
Yeah.
right. The second story is not really a story, it's just kind of a thing that happened in general to me. So when people are getting close to passing, or, you know, they're coming into the weeks where, you know, they're really not doing well, or, you know, you kind of get this like red flag as a nurse, like, okay, like, is this going to be the transition to like palliative care to keep them comfortable to whatever? So I always see this very tall spirit, black head to toe. He wears a long black trench coat and has a black fedora. And I call him the man with the hat. He comes when people are going to die very soon. And he's always close to their room. He's never in the room. He's always close to the area. And I just have this feeling, I'm like, okay, that's, you know, there he is. We got to prepare. And no sooner after I see him, usually within a week, the person kind of passes. So he kind of comes as like a, not like the Grim Reaper, but more easy Grim Reaper. Like he's not scary or anything, but he's like my mental note to be like, okay, like this is going to happen. Like they are on that transition, and it's never failed for all the people that I've cared for that have been in hospice or palliative care, which probably over 100. I've seen him every time.
That's
Wow.
interesting.
How do you see him?
Yeah, I've heard a lot of stories about the man in the black fedora. People seeing him.
Really?
I have. I've read it places, and it's real weird. It'll just come up out of the blue, like different places. But
Yes.
seeing a man that just wears, and they've said they didn't even look like he has a face. It's just like a
No, it's
black
just all black. It's
face,
not a face. It's just
right?
all black.
Yeah, yeah. And that's really interesting you say that because I've seen him associated with death a lot. So that's
Yes,
interesting.
he's very much prominent for death. I agree.
Think a lot of people associate because I have two guides that technically don't have faces.
Mhm.
They are just an outline. And one that appears as like in human form. But I always feel like people, and I used to associate this like with black or dark being bad and then light
Yeah,
being good. And
Mhm.
that's actually not true at all. Anything can appear to anyone as anything. It's the vibration that matters. But when you're telling the story, it's almost like his job is to help guide and transition.
yeah,
It's not
Exactly.
like he's a
He said he wasn't
scary.
that scary. He was
Yeah.
just
yeah,
there to like, okay, this is coming. We're going to help you cross to the other side when you're ready.
yeah. Very
Oh,
So
interesting.
how do you see him though? Is it like in your mind's eye? Are you seeing him physically? I'm
I
just
see him
curious.
physically with my eyes. Yeah,
Wow.
he is right there. Usually sometimes he's like on the corner, sometimes he's by the doorway, but I always see him with my eyes.
Interesting. Has
Interesting.
anybody else seen him?
Not that I'm aware of, but people like they have like they can feel his energy, I guess. Like, cause like, oh, like I go down there and it's, it's cooler or, I can feel like the tension or whatever. They know he's there. They just don't see him.
Yeah.
Interesting.
It's that feeling of death, right? Some people say, I just feel death around me.
Yeah,
And
it is. It
I
has
get
an
Oh,
that. Yeah.
energy, that's for sure.
Yeah.
hmm. Okay. So
Mm.
what was the other story you were telling me about?
This was Franny. I was caring for Franny when I was working, doing travel nursing many years ago. Well, not many years ago, it feels like that, but a couple years ago. So basically, Franny was as well like kind of like a hospice patient. She wasn't like eminently dying, but she was getting there. And Franny was nonverbal and in a wheelchair, so she couldn't speak. It was in like just not a good quality of life for her, and she was kind of on the radar as well. And it was December when I was caring for her, so it was really dark first thing in the evening, and we were short staffed. So I was like, okay, well, that's fine. I'll go feed Franny in her room. Like I don't have an issue to sit with her and feed her. And I'm going in there and I just kind of flick on the lamp so it's not like bright lights in her face because it's, you don't want to be annoyed by the bright lights. So I'll just turn on her little lamp, her bathroom light, and I'll just sit with her. So the way it kind of works is like I'm facing Franny like this, and the bathroom door is open behind me, just for like so you can get the visual example. And we're just going on. I'm talking to her like normal because even though she can't talk very much, she is you still talk to them like they're human beings. And after a couple bites, I just kind of feel this, like this cool kind of air behind me. And I thought, maybe the AC had clicked on for some reason or the fan was blowing. And Franny, who obviously doesn't speak very much, she said to me, my mom and dad are behind you. And I was like, I turned around, I was like, oh, hi, mom and dad. Like, I'm just feeding Franny. Like, I hope you don't mind. Like, I'm here as well. And then she said to me again, clear as day, she's like, they're going to come take me home soon. And I was like, oh, are they? Like, that's okay if you want to go home with them. Just, let me do my thing. And then if you want to go home with them, that's completely fine with me. And after I had finished feeding her, like, this kind of air had went away. And I was like, oh, we'll talk to your parents later. Like, we'll say goodbye to them. So I like said goodbye, goodbye. And the energy kind of went away slowly, but they were still kind of hanging around for a while. And probably what did I say? Maybe a couple days later, she had just went to and slept fast in her sleep. Just like that, her parents were coming to get her, and she was telling the God honest truth.
Amazing.
That was
That
actually one of my
is,
questions.
Mm-hmm.
Do you find that happens a lot with people? Do you find that they refer to like, oh, my family's here, they're coming to get
Yep.
me to go home?
Yep.
It's
Always.
amazing how they know it as home too.
Yeah, I'm
Like
going
we think
home. I'm
Earthers
going
are
with mom and
home.
dad. I'm going home. It's always mom or dad, or seldom it's like brother or sister, obviously, but usually it's my mom and dad are coming to get me and take me home.
Mhm.
That's pretty
Wow.
cool. I know, like I was telling my mom, I know when she was in hospice, when she was in her last moment, not, immediately, but there were times where she would be reaching out, like somebody was there
Yeah,
and
they do.
and
They
she
reach
was
out,
reaching
they
out to
talk to
them.
them, they see them. I've seen people even like point in their direction, like, oh, my mom's over
Yeah.
there. Mom is coming to get me and she's over there. Like, yeah, it's very, very, very common. And they always know, like, I'm going home. That's what it is.
So I think you said earlier that have you always been a spiritual person?
Always
Like,
since
okay.
as long as I can remember.
Have you noticed if in any of these experiences, have they strengthened that or just confirmed things for you or
Maybe
anything?
strengthened a
Has
little
it made
bit,
any
but definitely
difference?
confirmed, 100% confirmed. Strengthened maybe a little bit, but I still haven't kind of fine tweaked everything, like I said previously. But yeah,
Right.
definitely confirmed a lot of things for me.
Okay. That's
Do
really
you
cool.
find that this helps people before they're about to pass? Like, do you find that a lot of people are more comforted before they pass because they sense the energy? Or is there
Definitely.
still people that right up until the end are like, I don't trust that anything comes next?
No, it's definitely a lot of like calm. Like they have this like renowned belief, like I'm okay, I'm going to be okay. Like I've never seen anyone scared or like traumatized or anything like that. They're like, okay, I'm here. This is the end. I'm ready to go. And this energy is going to take me, or like my parents are here to take me. Like no one is ever like scared like that. It's always very calm.
That's very comforting.
Hmm.
Uh, I can imagine for a lot of people. I had another question.
Hmm.
Uh, when people are going to when people are going to pass, do you find that, oh my God, I lost my train of thought here. It's like, right when it's on like the tip of your tongue. Give me a minute.
Hmm.
You guys have the question. I need to
You
find my
have
thought.
something. You remind me so much of my niece, and my niece is a nurse.
Really?
She's in her last year of nursing school. And just your energy reminds me so much of her. And I know, I mean, growing up, I always had experiences. She has had the same experiences,
Hmm.
but is right now currently shut down, just like I was for a long time.
Hmm.
But have you had experiences like since you were a child?
Oh yes. Yep. I vividly remember like my old house was like not not there's a lot of spirits present. And I vividly remember I think I was like 5 or 6 years old and this happened. I was sitting on my stairs and I remember like someone was like talking. And I was like, no one's upstairs with me. So I turned around and looked. And my sister's door kind of like just closed a little bit ajar. And then I turned around and there was a spirit holding up a t-shirt, just being like, hey, I'm here. Can you see me? And then it dropped. And I was like, at the time, I was like, what was that? Like, no way I just seen that. But now, like, looking back, I was like, that was my first experience, like seeing and like knowing, like, hey, I have something going on, but I couldn't like describe it. But yes,
Yeah.
And
it's
that
been
takes a lot
very
of
long.
energy to do that kind of
Oh, it
physical
does.
mediumship, right?
Oh, for
So
sure.
that's really, really interesting. Are you highly sensitive and empathic? Because I get that from
Very,
you. Yeah. Yeah.
very,
You remind me
yes.
so much of my niece. It's
Oh,
crazy.
thank you.
Just
I'm
your
glad. It
energy.
reminds me of your niece.
Do
She's
you find
very,
it,
very sensitive.
do you find it's hard to do this job just because you are so sensitive to spirit?
Yes and no. I tend to be really like I'm very mindful of grounding myself and not trying to attach too many things to me because there is a lot of that comes with a lot of like grieving and a lot of like empathic, behaviors that do come with it. So I always make sure to ground myself. Like for the longest time I had to wear like an air black jade arrow like around my like and carry like crystals with me just to keep that energy like away because at one point I didn't know how to shut it down and like I just attached everything and everything came to me and I was so overwhelmed for a very long time before I realized that, I have to like put this barrier up and, exclude myself from so much because it's just going to weigh me down. So,
I got this vision of like, I don't know, is it Snow White that has all the animals that like flock to her?
yes,
That
Yeah.
it's like when I see you, I'm like, I don't know if you have dogs or like you're just a big
I have
animal
cats
lover.
and all animals love me.
Yeah, and I could just see all the animals just like surrounding you because you just have this beautiful energy. Beautiful energy. Have
Thank
you
you.
ever thought of, developing your spiritual gifts?
Yes, I have. It's just I had my daughter a year ago, so I haven't really had much time to, focus on that aspect as well. But I do want to like, develop it even further and, kind of hone in and strengthen it too, the best I can. It's just
Yeah.
I haven't really had time to sit down and be like, okay, this is what I want to do.
One thing I can honestly say is when you're ready, it'll appear.
Yeah,
When the student's
exactly.
ready,
That's
the
what everyone
teacher
tells me. Is
always
like when you're
appears.
ready, when you get
Yeah.
there, it's gonna come. You can't hold it back.
Yeah. Yeah. It will.
I think for like legitimacy purposes, I feel like because what you do for a living and
Hmm.
your experience is really gonna, people are gonna be drawn to that, right?
Hmm.
Because you've experienced these things firsthand.
Oh
So
yeah,
I
for
feel
sure.
like that's gonna make you even more of like a powerful medium. Here I am predicting where you're gonna be in the future. Maddie the medium.
That's right, Maddie the medium. That's me.
MM.
That's right, MM.
I
Found my
love that.
question. So my
Hmm.
question took me a while there where you guys chatted. Do you believe that people's consciousness shifts in and out for the weeks leading up to their passing?
Definitely,
Yeah,
definitely.
how
There's kind of these fleeting moments where they have like a reality. So I don't know if you remember, like on the episode of Grey's Anatomy when rest in peace, Dane kind of has that like moment where he's like, I'm gonna be Claire, I'm gonna tell everything everyone needs to know, and then they kind of they call it the surge, and it is a real thing. They do have these fleeting moments where like, okay, I need to get this off my chest, or like I need to say, I love this person, or I'm sorry, mom, for everything that happened between us. And they do that. People come clean, like weeks or days before they pass, or completely go unresponsive. And they kind of go in and out all the time. I've seen it many times actually.
wow.
Hmm.
That makes sense though. Like they have like this sudden burst of energy where it's like all their life force energy just needs to like
Yeah,
settle
to
everything
clear
on
off their
that.
chest, and then that's it.
Yeah, that's amazing.
Have
Yeah,
you
I
It's
feel
ever
like,
very,
seen,
very interesting.
oh, sorry.
Sorry, go ahead.
I, I know Ashley asked earlier if you've ever seen a spirit leaving a body when they passed. Have you ever noticed anything when they pass, like a spark or the lights go off or anything like that?
Not that I can think of, but like myself, I like when you have to pronounce it out, you have to like listen with the stethoscope over their heart. Hearing like the no sound is like almost, I can almost feel it like through my stethoscope,
Yeah,
but I've
yeah.
never seen anything like no spark or anything like that. I can feel
Okay,
it, but I can't see it.
One thing
gotcha.
is, at least when I was working in the hospital, although I wasn't doing a job as close as you, when you do encounter kind of, in the back there and you encounter, bodies after they've transitioned, right?
Hmm.
It is such a different energy because it
It is.
really is the soul that makes the essence of the human, right? And I
Mhm.
remember being and this spooked me. I didn't like being near a dead body. And I remember I was like, they literally at that point it just feels as if it's a vessel
It
because
is. It's just a
once
vessel.
once the person passes there is no energy. It is it's such a surreal feeling, but I feel like if I was in your shoes I would probably be able to feel just that moment of
Hmm.
transition because the
Yeah, you can.
energy shifts so much, right?
Yeah, you definitely can feel it.
What Ashley call it? Your meat suit? Yeah,
Is your meat suit because your soul is your divine spark. So that makes total sense, right? It's like it is the vessel, right? And
Yeah, it is.
what did they say? I used to always think that like your soul is in your body, but it's your body that's actually in your soul. And that
Hmm.
took me a little while to like wrap my head around. And at first I was like, huh? But I was like, as I started to sit with that and, the more knowledge and experience that I have, it makes more and more sense. I
Oh,
just
I
want
have
the listeners, just
heard.
going back to like what you were saying before with like, deathbed confessions, right?
Hmm.
And this has come up actually a couple times for me in this past week. So just like a thinking point for like the viewers is like, is there anything right now that you're holding back on doing that, if you fast forward, to when you're 90 and you're laying in that bed, are you going to regret it? Should you be acting from your heart now as opposed to regretting it later? Just something for people to think on because you have to like, you never know when time is up. You don't have like that clock on the bottom of your foot, and I feel like a lot of times we take time for granted, and sometimes we need to sit back and think, how can I be present today?
it's
So
very
I got a
true.
little deep here, guys.
No, it's very true. I think that I think you're right on mark there. We spend so much of our lives thinking about things in the past that we could have changed and thinking about what's going to come tomorrow. And we spend very little time thinking about what we can do to enjoy today and make things better for tomorrow and fix things from
Yeah.
yesterday today. Right. And you're absolutely right. A lot of the times to help you, you've just got to remember I'm living in this world today and tomorrow may not get here. So I agree. I agree.
Before we hop off, I want to tell you guys this really cute story that just popped into my head as we were talking about all of this of bodies transitioning and stuff like that. My son, he's 4 years old, okay? And the other night I was lying with him like I do every night in his bed. And that's sort of like my time to just kind of check in with my kids. We talk for a few minutes. And like he kind of stumbles on his words a little bit, but he gives me this really interesting kind of insight as we're talking about, I don't know, I was like, I'm so glad you chose me to be your mommy, is what I said to him. Like, I love you so much. And he's like, I did choose you to be my mommy. I was like, oh, yeah. And I said, why did you do that? He's like, I needed a mommy. And I was like, oh, where were you? And he's like, I was in heaven. And I was like, oh, you were in heaven. And like, I don't talk about this with him. And I was like, who was there? And he goes, a lot of kids. And he's like, there wasn't much to see, but there was a lot of kids. And I was like, okay. And I just sort of just pick his brain a little bit to see what he remembers, if he remembers, and I was like, what was it like over there? He's like, it was just love. And I was
Aw.
like, oh. And I just thought, like, he's like, Jesus was there. And he said he came here to protect us. Okay. He's a very protective little boy. And I said, well, who's protecting you? He's like, Dad and Jesus. I'm like, I'm not somebody that's very religious. I don't share this stuff with my kids. So this literally just came from him. And that's the reason I'm sharing this is because I'm like, I just thought it was so profound for a 4-year-old to be sharing these things. And he doesn't go to church. We don't go to church. This is not something that he's been exposed to on that scale. So I don't know what they remember, but I definitely feel like everybody has this remembering, and for a 4-year-old to say like just love over there, that was pretty
Yeah,
amazing.
that's excellent.
You know,
Touched.
there are a lot of kids, especially lately, that I mean, I believe all kids are born remembering, right? Remembering and being able to see, but it's society and our parents that kind of sometimes, you know, saying, you're not seeing that, you're crazy. That's not an invisible friend, or that's not a memory. That's your imagination. It kind of beats it out of you, right? So I
Mhm.
have no doubt in my mind that he is telling you what he remembers. And I'm glad that
Yeah.
you nurture that rather than trying to shame him with it. I'm really glad about that.
Well, yeah, I feel like I'm in a unique position to really notice this at such a young age. Both my kids are very sensitive, as I believe actually every kid is very sensitive. And they've both given me different insights on this at separate times in their lives. And I have no doubt that they remember. It's just that conditioning that as we grow up, they start to work it out of their mind. So I am just trying to help them, with that feeling. And I had gotten like my Reiki level one and I was just practicing. So I would practice on my daughter because she gets a lot of anxiety and she's very open to spirit as well. So I just thought like, okay, let's just practice this on her. And every time I would do it, she'd say, Mom, it just feels like love flowing through me. And I'm like, she's 7. And that's what we want Reiki to feel like, right?
Yeah,
Yeah.
absolutely.
All
What
right.
it
Thanks for
is.
listening.
That's
It
great.
was a beautiful story.
Yes.
It was.
Beautiful.
Mhm.
Was.
Do you guys have any more
Maddie,
questions?
thank you. No, I don't. I just want to say thank you for coming. You
Oh,
really
thank you guys for
you had
having
some
me.
great
It was
stories
great to
and
listen to stories, and I'm very glad to tell my stories as well.
yeah.
Yeah, they were so interesting. Um, okay, so that about wraps up today's episode. Thank you so much for joining us. I do want to say to our viewers that, all right, if you're feeling called to go deeper, you can book a session with us through the description in our podcast, I believe, and leave comments as it helps more than you know in promoting our podcast. Okay, thank you.
Thank
Till next.
you,
Thank you
guys.
so much.